Over 2,500 healthcare workers from the Department of Health in the Eastern Cape face a bleak future. Their temporary employment contracts are being terminated. The department says it started this year with a 4.4 billion rand budget shortfall due to the medico-legal claims it faces and is unable to extend the contracts. Affected workers include doctors, nurses and emergency medical technicians. Rando Nomoi has more on the story.
Well, you are coming to us from Gqeberha in Nelson Mandela Bay at the Department of Health District Office, whereby scores of health workers, have joined on the cry, of actually extending their contracts within the department. We understand that these are COVID-19 workers who worked, throughout all these waves of the COVID-19 pandemic. Now that they are crying foul, that they're being sidelined, that their contracts have been terminated, and some of them, they are calling, to report to work. But next to me, I've got a member of one of the unions, Umamu Nomonde Fanele, just to explain to us. Mamu Nomonde, thank you very much for your time. Just briefly tell us, what are you demanding, from the Department of Health, since you guys are here today?
Sasazi, we are demanding that these people must come back to work because already we are short-staffed at our clinics and the hospitals. Remember, Sasazi, we have in the COVID, this is the COVID, the workers, those who are testing COVID. Now, they say they didn't renew the contract of them. But remember, we are in the disaster. Now, the COVID sites are closed because they are out of work, off job. Even when we're supposed to test the COVID and vaccinate, because we are short-staffed, we are so shocked that the Eastern Cape, it's only the Eastern Cape that these people are outside. What's happening to the Eastern Cape? We are called to the Premier or to the President, if need be, to come and talk to us and talk to the Department of Health. What's happening here? And we heard that those contracts were not terminated because they are still up here in the system. If you terminate the contract, these people are supposed to be out. Meanwhile, there is no money. What the system it's on. Because we are talking about the pesos here, and we are talking the money, but the disaster money. We're not talking about the budget of the Department of Health. There is a budget of the COVID, but the Eastern Cape, always when there is a problem, there is this corruption of the people undermining our community. The clinic that is closed for 2 weeks now. What's happening to that community that are taking the chronic tablets, every medication? What's happening there? Because they employed the contract workers, but because of those contract workers at work, the clinic realized to be closed. We want the answers, and we don't want the answers to somebody come and say, I'm here, I'm on behalf of the MEC. Because MEC talk to the media and say we were not terminated the contract because we were on leave. Nobody can sign those land. So as us here as a union, as a chairperson of the NUMSO, the union that is registered, is affiliating to the SAF, we say we demand these people to be at work as from tomorrow.
And if now that doesn't happen, because we've been standing here for quite some time, Mama, and that the MEC is also not available, what is the next step as a union and as healthcare workers within this space?
Sasazi, what we will be doing now, when the MEC is undermining us, because we hear that the MEC is around, even the Premier is around, because we hear that the Premier will address the unions at 5:30. Because of us, they undermine us. You see, why the Premier is going to address the unions at 5:30? Meanwhile, we are here. We are talking about the community. We are talking about the people that are suffered. We are not, because we see this EMS, there is no ambulance. There is no ambulance. You call the ambulance for 4 hours. The ambulance are sitting there at Dora because there are no driver to drive those ambulance. Yes.
Thank you so much, Mamu Nomonde. That was Mamu Nomonde from SAF, a trade union associated and also with healthcare workers, just briefly explaining to us, the plight of these healthcare workers that they are facing, that they are demanding to go back to work tomorrow. However, they are also saying that the department says that their contracts have been terminated.